Something feels unusual about these numbers. Hundreds of defendants, billions of dollars. Patients allegedly receiving unnecessary treatments. For fraud to reach this scale, it usually takes more than individual criminals making isolated decisions. Systems matter. Healthcare is one of the largest and most complicated financial networks in America. It processes enormous amounts of money at incredible speed. And whenever a system becomes this large and this complex, a different question starts to emerge. How does fraud become big enough that hundreds of people allegedly think they can get away with it? Because if this hearing only ends with handcuffs and headlines, it leaves a bigger mystery unanswered. What made this environment so vulnerable in the first place? And that's where this story takes a turn that almost nobody expected. If you enjoy investigative breakdowns that go beyond the headlines and uncover what might actually be happening beneath the surface, subscribe to The Rebuttal for more videos like this.
Thank you to the White House Fraud Task Force, to Colin McDonald of the Justice Department, to Director Kash Patel of the FBI, to the HHS Office of Inspector General, Dr. Oz and the CMS team, and the investigators and law enforcement officers who brought these cases forward. President Trump directed this administration to confront healthcare fraud aggressively, and we are doing that. The 2026 National Healthcare Fraud Takedown uncovered $6.5 billion in alleged fraud, the second largest amount ever charged in a single healthcare fraud operation. The Department of Justice charged a record number of Medicaid fraud defendants. More than 440 defendants now face charges. This effort brought together federal agencies, state partners, and U.S. territories across the United States. 18 of the participating states, as Attorney General Blanche pointed out, were blue states with Democratic governors. Fraud does not recognize party lines, and neither does accountability. Today's cases include the largest Medicaid fraud enforcement action in the Department of History, 165 defendants charged with allegedly submitting more than $200 million in false claims to Medicaid. These schemes did not target government programs, they targeted the American taxpayer. They stole money from workers who pay taxes, from families who depend on Medicare and Medicaid, and from patients who trusted their healthcare professionals to be serving their health interests when it turns out they were just chasing money from our agencies. The allegations in these cases are particularly disturbing. Some defendants allegedly ordered medically unnecessary tests. Others prescribed products that patients did not need. Some allegedly fueled opioid addiction to increase their own revenue. In certain cases, patients allegedly died while believing they were receiving legitimate medical care from providers who only viewed them as billing opportunities. These defendants did not simply break the law, they violated the trust that patients place in medical professionals.
The strange thing about the hospice example is that it almost sounds impossible. Patients in hospice are, by definition, nearing the end of life. So when officials say they found facilities where people seemingly lived forever, the issue isn't just fraud, it's detection. Because somewhere along the way, systems designed to identify unusual patterns either didn't see the warning signs or didn't act on them quickly enough. And that's an uncomfortable idea. Most people assume fraud happens because criminals are exceptionally clever. Sometimes it happens because institutions become so large and process so much information that obvious patterns stop looking obvious. The hearing started as a story about alleged criminals. It's slowly becoming a story about whether the system itself made exploitation easier. Then RFK Jr. raises an allegation that completely reframes everything you've heard so far.
One of today's indictments charged a hospice owner in Los Angeles area and two marketers in a $27.7 million Medicare fraud scheme. According to the indictment, the owner paid illegal kickbacks to obtain personal information of deceased Medicare beneficiaries. One of the ways that Colin and Dr. Oz have been chasing down hospice fraud, we've closed now 800 hospices in LA. And one of the ways that we've been able to detect that fraud is that in many of them, the patients never die. they live forever. That's not supposed to happen in hospices. And this particular owner was actually going out and purchasing names from coroners of dead patients and then billing us for those, to make it appear that some of his patients were actually finally dying. And while taxpayers funded these false claims, the owner purchased a Rolls-Royce Phantom. That case illustrates exactly what is at stake. Every fraudulent dollar diverted into a criminal scheme is a dollar unavailable for patient care, for medical innovation, or for services for vulnerable Americans. During the Biden administration, my predecessor implemented two reforms at HHS. One of those was the so-called pay and chase system. We know when invoices come into my agency, we can tell that some of them are fraudulent or probably fraudulent. And the new system said, we're not going to stop those payments. We want everybody paid, and then we'll claw them back at the end. It was called pay and chase. And when I asked people, the careers at HHS, how could you do this? This is crazy, because of course we never claw back anything. They said that they were told to focus on enrollment and not fraud. The other thing that they did is to liquidate our program integrity office. So when my predecessor came into office, there were 80 people in program integrity, which is not enough. It's 50 states and 5 territories. And when I got in, there was only 6 left. So all of those people were transferred or let go, and we were literally doing no program integrity. And that opened up the floodgates for all of this fraud. $100 billion in fraud a year that are being stolen now from my agency. The federal government paid claims first and chased fraud after the money was out the door. And that approach, of course, failed taxpayers. We are ending it. HHS is replacing the old pay and chase system with a detect and prevent strategy that identifies suspicious claims before the taxpayer dollars ever leave the Treasury. We are deploying advanced artificial intelligence and data analytics to identify fraudulent billing patterns in real time, stop improper payments before they occur, and strengthen oversight across federal health programs. Our objective is straightforward: to stop the fraud before it happens. The people charged today should understand that we will continue expanding these capabilities, strengthening enforcement, and pursuing every credible allegation of fraud. If you exploit patients for profit, if you steal Medicaid or Medicare dollars, if you treat taxpayer dollars as your personal bank account, we will investigate you, we will build the case, and we will bring you to justice. We will find fraud, we will stop it, we will recover taxpayer dollars whenever the law permits, and we will restore integrity to the programs that millions of Americans rely on for their care. Thank you, and I now want to introduce Colin McDonald from the Justice Department.